And to follow Jillian, your new Secretary of New South Wales Health, Elizabeth Coff, who comes also from the front line, having run children's services in New South Wales. Welcome to Elizabeth Coff.
Good afternoon, everyone, and welcome to the Festival of Contagious Ideas. I too would like to acknowledge the traditional owners of the land and pay my respect to elders past, present, and I do like the addition of future. Norman, it's a good one. Yes, this is my first seminar as Secretary, but rest assured I have long-standing experience in the health system. I am a product of the health system, and I certainly love the health system, and it's my aim to build on the extraordinary foundations that have been laid by both the Minister and my predecessor, Mary Foley. So it was not without some hesitation as I went through the gruelling process of the job application as to what was my vision for the health service. And that seems to be the critical question that everybody's asking, not only here in New South Wales, both nationally and internationally. I had to give it some thought and have my elevator pitch ready at the many interview processes that I went through. But it assisted me in crystallising my thinking of where the system needs to go to maintain itself at the forefront of Australian jurisdictions in health service delivery. And innovation is a core part of progressing us on that journey. And most simply I can describe it as going from volume to value-driven care. Value-driven care is at the heart of where we need to go. As I mentioned, nationally and internationally, health systems are grappling with many issues, and these will all be familiar to you. The population health growth, the technology advances, the increase in chronic disease. They're all listed there. And as identified at the bottom of the slide there, health spending has risen faster than economic growth in every OECD country. That represents a challenge for us, because inherent in that, community expectations are high as to what the health service can deliver. But often also then, on the reverse side of that, is the willingness and preparedness of people to be taxed for their health service. So governments are in a very challenging position. In Australia, in the most recent Australian Institute of Health and Welfare report, 9.7% GDP is health expenditure now. That's up to the highest it has been since it's been recorded. $161 billion nationally are spent on healthcare, a truly large number. In New South Wales, the health budget is 28% of the state budget. And this year we hit the $20 billion mark, which is an extraordinary amount of money. Our challenge going forward then is increasing demand, increasing expectations. How do we as a system and people at the front line of service delivery cope with these significant changes? Reform has become part of the natural narrative of healthcare delivery now, and it will continue to be, I'm sure, going forward. The Commonwealth is introducing reforms around MBS and the review of the MBS system, and we are in deep negotiations with them about future funding around healthcare delivery. But it's not all doom and gloom. As I mentioned, under the stewardship of both Minister Skinner and Mary Foley before me, we have put the building blocks in place to assist in that ongoing transformation and reform journey that we are on. Patient decision making is closer to where it should be. The devolution of responsibility, the creation of local health district boards and network boards has been a crucial governance step that's been very important in progressing us on that journey. Healthcare transparency in activity-based funding has been a cornerstone tool of enhancing our understanding of the cost of health delivery and care. The integrated care strategy has been extraordinarily successful and at the forefront of where the nation has understood it needs to go in healthcare delivery. Partnerships also are critical to us delivering in healthcare. And as the Minister described in her speech, innovation occurs at multiple levels amongst all those endeavours in which we pursue. The most important thing I would like to emphasise, and it was pleasing when Norman did offer the commentary, that the health system is strong and the health system is not in crisis. No other country has better health outcomes per capita expenditure than New South Wales. We'll compare ourselves to countries even though we're a state. If you look at the 4 quadrants in which this is divided, and you can see in terms of the axes, we've got public and private healthcare expenditure against years saved preventable mortality, and New South Wales is positioned at that axis. In comparison to some other countries, as I mentioned, no other country has better health outcomes for the expenditure. This graph was developed by Bureau of Health Information and released in 2011. The picture is changing though, and this is the updated one, and you'll notice the axis on cost is shifting up, and actually in that also there is a reduction in, say, early preventable mortality years. So the challenge is up for us in rising costs to maintain that. And as you can see from the movement, some of the other countries are catching up. So what is the next step for us going forward? What we need to do is shift the paradigm from volume to value-driven care, the next step in our reform journey. Activity-based funding has been an important component of our journey, as I mentioned, but what we need to ensure is the outcomes that we're getting for the purchase of that activity. That's simply what value is. It's about the outcomes achieved for the dollar spent. Efficiency and productivity may be mantras of financial boffins from Treasury. I hope there's no one from Treasury here. But in health speak, value is what we aspire to. Measuring the outcomes from the perspective of the patient for the dollars we've expended. This will manifest itself in a number of different ways at a number of different levels, and it's everybody's responsibility. If we're going to shift and focus on patient outcomes, it requires the ministry and the pillars as system managers to look at how we do our business differently. We need to have new payment models, more effective statewide planning. We need to fast track some of the enabling IT. As the Minister mentioned, IT is fundamental to our innovation. New models of care requiring innovation. Quality and safety capacity building will represent value, as also will translational research. Innovation is at the heart of all those elements. But also at the districts and the network level, patient-centred care must be at the forefront of what we do, not simply the rhetoric of we've got a couple of consumers on our engagement committees. Truly understanding what consumer or patient preferences are is critical. Once again, I repeat the quality and safety component. That is a critical issue of the outcome of the episode of care, and adverse hospital events are not good quality outcomes for patients. A culture of improvement, care integration and collaboration will be critical for us to have impact on the value of care we are providing. So on our journey from volume to value, we will be articulating more explicitly some of our priorities going forward. Safety and quality will be at the forefront of what we wish to achieve. We will have new models of care with less variation. The system redesign with new process improvement will be critical, and importantly, people and culture and developing our workforce will be absolutely vital. We've identified a number of areas which we will focus on, and it was an extraordinarily high-tech slide, this one, and if I had the capacity I would have focused on some of those individually to give you some insights, but there's a big zero flashing, which my time's up, so I'll move quickly. Not to forget, most importantly, consumer input, perspectives, focus, centering will be critical. The BHI report did identify patient experience as good to very good across the health system. But as you can see in some of those areas, we probably haven't done as well as we could. If 60% of patients feel they were involved in decisions about their care, we need to wonder what happened with the other 40% about their collaboration and co-contribution to their care. Integration with GPs will be absolutely critical. So, shifting the paradigm from volume to value is a leadership imperative. I am a firm believer in distributive leadership, that every person across the organisation has a leadership role to play, no matter what your level. It doesn't come with positional authority, and most of the best innovation, I believe, comes from the leadership demonstrated by clinical staff. We need to listen, learn and challenge. And what we need to do then in response to that is to measure, innovate and reward. I believe through this process and with the collective enthusiasm, commitment and innovation that resides within the health system, we will continue to be at the forefront within Australia, but most importantly, provide the best care possible to the community of New South Wales. Thank you.